Hi, I'm Monica Healy. Welcome to Fertivity and to our Fertility Friends interview series. For more interviews like this, visit fertivity.com. I hope you enjoy this interview.
Hello everyone, welcome to another edition of Fertile Friends. I am your host, Elisa Beck with Anyas, and today our guest is Anya Sizer, author of the book Fertile Thinking. Anya is currently a fertility support co-coordinator at the London, UK Women's Clinic and also a fertility coach trained with Power Change Coaching. Today we're talking with Anya about some of the emotional impact of IVF and how she helps couples during their fertility journey. Now, what makes this guest even more special is the fact that she is the proud mom of 3 children, 2 of whom were conceived with IVF odds of 1 in 125,000. And it's that type of success that gives all of us and you listeners so much hope. So Anya, welcome to the show and thank you for joining us today.
Well, it's lovely to be here. Thank you for having me.
Now, Anya, one of the things that you regularly give workshops and talks about is the emotional impact of infertility. Mm-hmm. In particular, we're talking about the frustration and despair that fertility brings and, in fact, just the sheer enormity of it all. Mm. When a client is in this state, I know it can perhaps sometimes be very hard to see one's self-worth, and I'm talking from a personal perspective here. Mm-hmm. So what is the first thing that you share with these couples, and how do you guide your clients through the first steps of coping with all of these deep emotions that come with infertility?
I think the first thing that I'd always want to do with clients is just really normalize and validate the feelings that they have. When we go through any problems with conceiving or trying for a family, it really strikes at the heart of who we are as people. And, I can certainly speak as a woman, but as someone who watched my husband really grappling with all of this as well, I know that it really cuts right to the heart of how we perceive ourselves and how we see ourselves in terms of our friendships and our relationships and our interactions with other people that we know or don't know. It really cuts to who we are. And so when a couple comes to see me or when an individual comes to see me, I just would want to start by saying, do you know, you're not making this up. You're not making a mountain out of a molehill. You're not exaggerating. This is really, really tough. It may well be one of the toughest things you ever face. And so give yourself a break. Take a deep breath and know that these emotions are normal. And I think sometimes even just giving people that permission is so helpful and so healthy, because they're generally people that are trying very, very hard to squash down those feelings and to, not compare themselves to people starving in Africa or, other people have got it much worse. And actually by stopping them and saying, look, do you know what, this is tough, I think it just gives permission to then start to deal with the emotions. So rather than coming at it, you ought to deal better with this, you ought to be, coping better, pull yourself together, I start with the opposite. I start by saying it is really tough, and now what can we do about it? So it's the opposite way to many people's way of dealing with it. I think it just starts with just saying, well done, you're here, now what can we do?
So we are looking at starting with a solution. We're acknowledging the issue,
yep.
And now we acknowledge that we're here at this place.
Yep.
How do we move forward?
Yes, absolutely. Okay. So it's then listening to where they're at, what they've done, some of the issues that are coming up. And then I'd like to try and, in a first session say, okay, what do you need right now? What's the most important thing right now? I always see fertility coaching as throwing people lifelines when they're going through fertility treatments or trying to conceive. Just so rather than doing a big picture and saying, okay, what's your big life plan or anything like that, it's more small scale, saying to people, what do you need right now? What's going to get you through this next day, this next week? And very often, one of the initial things that comes up is helping people with their self-belief and self-worth. So we may well spend some of the first session really looking at that and how they're perceiving themselves, and then thinking of some practical ways to encourage and help them over these next few days. So it's lifelines. I'm throwing out lifelines for them, and together, between the client and myself, we're coming up with strategies and tools to move them forward.
That's a really good way of looking at it in throwing out lifelines. In doing research on various fertility issues and in having gone through the infertility journey, one of the things that seems to hit home the most, and one of the things I see connected, is that the emotions can send patients into deep depression and despair sometimes. And so that emotional and sometimes that physical pain that comes along with that as well tends to be less visible.
Yes.
And therefore much harder for others to feel empathy towards them sometimes. I mean, what are your thoughts on that?
Well, I'm nodding away here. You can't see that, but I totally agree. I think it's a very misunderstood area. One of the wonderful things about the media is that we know such a lot about IVF and fertility treatment now. The flip side of that is there's an awful lot of opinions about what IVF, what fertility treatment is out there, and people feel they know what treatment is like without actually having a clue. And so you get a lot of impressions of, oh, well, IVF, it works first time, or IVF is a lifestyle choice, or IVF is for people who are honestly too posh to have sex. You have so many weird concepts, and this filters through to the general public, who then have an even bigger reality gap to bridge when talking to a very, very frustrated individual going through the whole heartache of trying to conceive. So you have often a massive gap between people's comprehension of what an inability to conceive actually feels like, and what it really genuinely does feel like for a person. And so I do think empathy can be very, very difficult to muster for many people if they haven't been through it, if they don't have a comprehension of just how fundamental a drive it is to procreate. So you get a lot of opinions, you get a lot of misunderstandings, and that can really lead to an individual or a couple feeling very isolated, and that then adds another layer onto all of the other stuff that they're going through. But I certainly do feel that. And I think another issue that comes up in terms of empathy is that very often, it takes a while for a couple to conceive, or for an individual to conceive, and people get tired of empathising. If you have got someone that maybe at the beginning who was very sympathetic and listened, by IVF number 3, it's almost as though you can see family members banging their head against the wall and just saying, stop already. I know for myself I had that. I had many close friends just saying, please, can you just stop? We can't bear you going through this anymore. So I think to really find people around you that will stay with you for the long haul and really try and listen to what you're actually feeling, I think that's a really special thing. And when you find them, hang on to them, because they're really needed.
Oh, yes. That emotional encouragement from all sources around you is definitely very important. Now, you have mentioned that in your previous writings that 1 in 6 couples experience difficulties in conceiving. That seems to be a high percentage. And contrary to what some people may believe, it's not all necessarily due to age-related factors. So do you have an opinion on why infertility seems to be on the rise? Yeah, I think it is high, and it's tragically high. There's many, many reasons. One of the things certainly is that there is a shift of people leaving it later for one reason or another. And the only thing that I'd always want to say with something like that is that there's, again, a media perception that women leave it later because of careers. And honestly, that is so rare that I see that. Generally, women are leaving it later because of life partners coming along later. So, yes, one of the issues is often age-related, but that's to do with circumstances generally out of people's control. So that's one factor. You then do have lifestyle factors, so certainly obesity, smoking, poor diets, stressful lifestyles and lack of sleep, all of those kind of things. They all can contribute, sometimes in big ways, sometimes in subtle ways, to the whole fertility picture.
So there's a huge amount of reasons why a couple may struggle to conceive, and it's certainly not just a one size fits all. That's why it's really important for a good physician to listen to people and to really piece together what might be going on, because generally fertility issues are a myriad of things rather than just one thing, and you need to treat the person holistically. But there's definitely things in the environment that are causing changes. There's smoking, obesity, things like that really do have knock-on effects onto fertility. So it's a huge array of things. There's no one aspect.
Let's talk a little bit about the image that some women associate with themselves throughout this journey. Mm-hmm. You had a client who had over time begun to see her body as faulty. And unfortunately, this image was then further reinforced by being what the clinics referred to as a poor responder. And after 2 failed cycles of IVF and not much feedback from her clinic, she came to you, from what I understand, believing that her chances were negligible. And then you happen to talk about using a very simple technique for challenging her self-beliefs that were leading to restricted behaviors. I mean, this is some fantastic stuff, Anya. So can you expand on that a little bit here for our listeners?
Certainly, yeah. I think this is one of the things that I get most excited about. We all, every day, carry around assumptions about ourselves and about our life without even realizing it. And one of the things I most love about coaching is it puts a pause on those negative voices that are going on and just challenges them a little bit. So one of the things that I'll use on that is something called the 3-question technique. And it's a really simple tool that anyone can use. What it is it gives someone space to realize the phrase, the loop, the saying that we're saying about ourselves in our head, and to challenge it. So, for example, this wonderful woman had come along and she'd had some times in the clinic that had been unsuccessful. She'd had some unsuccessful cycles. And because of this, she'd leapt to a conclusion. Because of lack of evidence, she thought contrary to the opposite. She felt she had a body that wasn't working properly, that she was somehow failing as a woman. And the loop that was going around her mind constantly was, my body is faulty, my body is faulty, I'm never going to have a baby, my body is faulty. So we just paused that phrase and just said to her, now look, let's use this 3-question technique to just challenge, is that true? So what we do is we say, is the phrase true? That's the first question. Is it helpful to me? And then, is it helpful to anyone else? So those 3 questions. So the first step is the phrase true? So we then looked at what she was saying. My body is not working. Everything's going wrong. It's not functioning as it should do. And we just said, look, where's the evidence for that? And we realized, using this technique, that actually she hadn't had much feedback at all from the clinic, and she really did need to know some facts. And that's the key thing here. It was facts and not emotions that she needed. The emotions were telling her one thing, but actually the facts were that she needed some more feedback from the clinicians around her in order to get a better impression, a truer impression. So that first question, is the phrase true? I then sent her off to find out more evidence and to find out the reality of it. We then looked at, was the phrase helpful to her? And certainly not. I mean, you can imagine being someone with a constant loop of, I'm not working, it's all going wrong, it'll never work, was just adding stress upon stress upon stress and making an awful situation worse. So we just stopped and we said, how might we be able to help ourselves at this point? What would be a more helpful thing to be thinking? And bit by bit, we unpicked it, and she came up with, actually, it hasn't worked this far, but that doesn't mean it's not going to work in the future, and replaced that loop that she had for so long been carrying around with her, and just replaced it with something much more enabling for her. So is it true? Is it helpful to me? And is it helpful to anyone else? Well, it's not helpful to anyone else, because carrying around such a self-worth and such a negative perception of ourselves, we push people away, we push relationships away, we push other people away. And even for her, she was pushing the clinicians away and not really giving them the chance to bring reality into the situation. So that was session 1. And then she came back to me with much more feedback from the clinic. The clinic actually felt that, no, it hadn't worked up until this point, but here are some ways that they can help her. These are some things that we can do. And it's certainly, unlike how she perceived herself, it wasn't the end of her journey. It wasn't the end of the road as far as they were seeing it. So that was amazing. We had a real breakthrough in the second session. And actually, she then went on to have another IVF session, and this time with the loop again going around her head of, well, why not? This could happen. It hasn't happened this far, but there isn't a medical reason why it shouldn't happen. And she really worked on using the positives in her voice and in her head now, and actually went on to conceive. And so very exciting. And it's just a very simple 3-question technique. Is it true? Is it helpful to me, and is it helpful to anyone else? And it can be utterly life-changing to use such a simple tool.
And it sounds as though it also encourages more of a team approach to the care as well,
yes.
and encouraging more communication between the patient and the doctor.
Yes, very much. And it's amazing what emotions do without us even realizing. You know, if we go into the next, post-IVF meeting where, say, an IVF hasn't worked, if we go in with a mental attitude of, this is never going to work for me, why am I bothering? You know, you won't listen clearly to what the clinician is saying back to you. So, you know, it's really important to separate the emotions from the facts. And I think that's where something like this can really enable a person, help a person to move on. And again, it comes back to just giving yourself a little bit of a break. And by doing that, you help other people to help you as well.
Another thing that may help, as well as getting that full picture, I want to give you an example of what I'm talking about. We had a client that was going through IVF, and we saw her for an ultrasound. And during this ultrasound, she found out that she had endometrial polyps that she didn't even know that she had. I mean, and endometrial polyps can block conception. So, and again, she had been trying to conceive for 3 years, didn't know that she had the polyps. She had the polyps removed and was able to conceive successfully after that. So you mentioned that you offer support for many fertility issues. Do you initially go over medical history and give advice, or do you direct your expertise solely on the emotional side of infertility?
Yeah, I'm more the emotional side, but I really love your story because I think that's one of those classic cases where the emotions could definitely have been blocking her from finding out the medical reality. You know, she could have been someone that easily was saying, I don't know, maybe I'm destined never to have a child, or maybe I've done something wrong, or maybe it's not my time, or maybe I'm not feeling positive enough about this situation, when actually there's a medical issue going on. And so I love that. That's a fantastic story about, just coming back to the reality of a situation for a person. But for me, no, I would always say, look, get recent checks done, make sure that you're up to date with all of your hormone levels and everything that's going on, thyroid testing, maybe immune testing, all of these kind of things. Get the fullest picture you possibly can. And from that, with the emotional support, then you move forward. But I think the two go hand in hand. I'm a big believer in holistically getting through fertility issues, because we're not just a medical cabinet. We're people with emotions and emotional needs as we go through this.
And that's one reason why I loved your answer to the previous question, which talked about her being able to discuss her emotions related to it. Like you said, it's a very holistic approach that also involves an entire team, from the medical to the emotional aspect. Now, one of the things you also touch on are the ethics of IVF. You've mentioned that you belong to the Church of England, and personally, I can appreciate and respect your thoughts on the loss of embryos. Can you take a minute to talk about that for some of our listeners that may be struggling with this issue?
Yeah, absolutely. I mean, all of this has to be that this is just my opinion, and I know I will differ from many scientists on this and people involved in IVF in general, so I can only speak for myself. But I do think actually there's a whole area of IVF and fertility treatment that is overlooked, and that is the kind of ethical and spiritual. And it can be in the rush to get someone pregnant and in the rush to just get on with IVF. I think sometimes clinics don't always listen to people's ethical stance, and again, that's part of the whole holistic picture, that this is really, really important to many people. And so for me personally, I do think embryos are very special, and for me they're the potential to create a human, a life, a baby. So I think we really need to treat them with respect. Now, this isn't to say I have the answers to everything, but that's definitely where I'm coming from. And I have worked with people, again, very similar ethics, who are desperate not to have what some people would call surplus embryos. I think there are ways around that. You can opt to only have a certain number of eggs implanted and certain number of embryos created. If you do end up having frozen embryos, possibly to look at maybe donating them. I know in the States you're way ahead of us with that whole movement. In the UK we're just starting to think this through, and I do hope it's a move that we start to go down, because we do get people certainly in our clinic saying, do you have any embryos for donation, and it's very rare in the UK that we do, but that's another option, that embryos, spare surplus embryos, can be donated to a couple that are desperate for a child. But again, I think it's part of really, really listening to an individual, rather than just thinking, there's a one-size-fits-all IVF technique. It's really thinking, there's a couple before us, what matters to them, and what matters to them about their embryos. So I would be really keen to talk that kind of thing through with people and to really listen to that aspect of them. I think it's important.
Thank you for providing your opinion on that for us. I think one of the best ways to tie this up is with this quote that is just perfect for what we've talked about today. Emotional support can transform your fertility journey. In closing, can you offer your advice to those who may be at the beginning of their own personal fertility journey?
Yeah, absolutely. First of all, really good luck, and there's a whole load of us out here rooting for you, really, genuinely. Don't underestimate what you're about to go through, what perhaps you are already going through. It may well be one of the toughest things you ever face. As such, give yourself a break and get the best support you possibly can. So draw up a list, again holistically, of all the people that might be able to help you. Who's going to be on your cheer team? Who's going to be there emotionally? Who's going to be there physically? Who's going to be there spiritually? Who's going to be there medically? And then call on that people, and really, as you move forward, make sure that you have all the support you possibly can. Work on friendships and relationships as much as you possibly can. Try where you possibly can to not lose sight of yourself. You're more than just a fertility patient. You're more than just someone trying to conceive. You're an amazing person in and of yourself. Try not to lose that, but give yourself a break for those days when actually it's very difficult to only think about fertility stuff and to switch off. Everyone has days like that. There's some amazing specialist support out there on Twitter. We have things like the Infertility Network over here. I know you have Resolve. There's some great support out there, so get linked into those kind of things. And then just take a deep breath and go for it. It may take a while, but there are some amazing, amazing ways to create your family out there. And in time and with perseverance, many people get there. And I really do wish the best for every single person trying out there. I really do.
Oh, Anya, thank you so much. Now, where can our listeners find out more about you and your work?
Well, I work solely now from the London Women's Clinic, so you can go to the London Women's Clinic website or my own website, which is thefertilitycoach.co.uk. There's also my book, Fertile Thinking, which is now being made into a course which we run at London Women's Clinic and is helping many people, I hope. And get in touch with me. I'd love to hear feedback from today. I'd love to hear how people are going, and I'd love to hear how people are using maybe the 3-question technique or the cheer squad technique or anything like that. It'd be lovely to hear how people are going.
Thank you again, Anya, for sharing so much of your knowledge with us today. This has been an incredible chat. And thank you, all of you listeners, for listening to this edition of Fertile Friends. Again, just to summarize today, our guest has been Anya Sizer, author of the book Fertile Thinking. And again, she's currently a fertility support co-coordinator at the London, UK Women's Clinic and is also a fertility coach trained with Power Change Coaching. So we've talked a lot today about the emotional impact of IVF and just how Anya goes through her journey of helping couples through their fertility issues. Again, thank you very much for joining us, and thank you for sharing your knowledge.
It's been an absolute pleasure. Best of luck to everyone.
I hope you found this interview helpful. Please send us any feedback or comments. For more interviews like this, please visit fertivity.com. Until next time, thanks for listening.